All right, this is Alice Shapiro, your instructor for HIT 154, and this is the continuation of the screencast narration for musculoskeletal and skin diseases. I'll mostly be talking about skin diseases, and actually this is, according to our curriculum and sequence in which we study things in this course, this will be the last PowerPoint recording for the term. Again, remember you can go on Moodle page and see all of the recorded PowerPoints I have done, both again, of course you can play them again, and also the non-narrated versions are available so you can take your time and read and study as well. All right, just to conclude about bones, some age-related diseases of the bones. In this case, the osteoblast activity declines, and remember the osteoblasts are the stage of the bone cells when they are building bone. Aging bone has more minerals and less protein, and the tissue therefore becomes more brittle, and the total amount of bone declines with age. At menopause, bone loss accelerates in women, making women more susceptible to osteoporosis, although men do get osteoporosis. More than 80% of those with osteoporosis are women, and a majority are over the age of 60. And although I would disagree that most women over the age of 60 have actually medically diagnosed osteoporosis, many suffer from osteopenia, which is a lower than what is considered normal bone mass, bone density. Also, there are age-related diseases of the joints. Mobility often decreases with age because the cartilage becomes stiffer, the ligaments lose their flexibility, we have more collagen fibers versus less elastic fibers as we age, and the synovial membranes become more fibrous and stiff and produce less fluid. So there's more friction, less mobility. The incidence of arthritis increases with age, and that's mostly osteoarthritis. While fewer than 20% of young adults have arthritis, 60% over age 60 have some form, and as I said, most of these are osteoarthritis. Muscles become less sensitive to stimulation. After contraction, the recovery is more slow, and therefore it's more difficult for endurance activities, often with age. The number of muscle fibers decreases with age, and they become shorter and thinner, and this does reduce muscle strength and range of motion. Caveat though, if you keep exercising and moving and do some weight-bearing exercises, you can mitigate some of these problems and certainly slow down the progression, as you see. So exercise, good diet, these are extremely important all throughout life and not to be forgotten as we age. And even if a person has had a poor diet and low exercise throughout their lives, even at older age, they can begin to treat themselves, let's say, better, and can certainly improve and decelerate the loss of the flexibility and the loss of muscle mass. All right, let's go on to skin diseases. Many skin diseases are identified by visual examination, and we can culture the scrapings from lesions or test the blood for antibodies, and therefore can recognize some of the causative agents. Complete medical history as usual, including prior outbreaks and location. Sensitivity testing of the skin or blood tests for antibodies may be used to identify the allergen. Biopsies are used to diagnose benign tumors and to distinguish them from malignant tumors. So there can be a punch biopsy in which a little piece of tissue is just punched out. Incisional, of course, in which there is an incision and part of the tissue in question is taken out, or a total excision of the tissue to be examined. They are identified and classified according to the characteristic lesions. So, including, we analyze the size, shape, color, and location, and presence or absence of other signs and symptoms. Itching, swelling, redness, and inflammation usually accompany the lesions and can be helpful in making a diagnosis. So pruritus, edema, and erythema. All right, let's take a look at skin cancer. Here are some of the types of skin cancer: basal cell, squamous cell, Kaposi's sarcoma, which usually accompanies HIV/AIDS, actinic keratosis, and malignant melanoma. Basal cell carcinoma is the most common skin cancer. It's slow growing and generally does not metastasize, and generally develops in the face of people with lighter skin. Lesion begins as pearly nodule, and ulceration occurs and the size increases if it is neglected. It can be surgically removed, cauterized, or radiated. And here is what it might look like. Squamous cell carcinoma is another type of skin cancer. Here is a photo of what it would look like. It's more serious than basal cell because it does grow rapidly and does metastasize through lymph channels. Squamous cell is a malignancy of the keratinocytes in the epidermis of people who have been excessively exposed to the sun. And you just saw what the nodule might look like, and it should be completely excised surgically and or treated with radiation. Sometimes both are done. Here's actinic keratosis, caused by, again, excessive exposure to the sun, and it's more common in middle-aged, fair-skinned individuals. And you may have multiple wart-like lesions in this disease, and those would be on the face, arms, and legs. Sometimes topical treatments such as Retin-A may be used, but surgical removal is often the best route to go. Here's a Kaposi's, or a Kaposi's, I should say. I always want to put an R in that for some reason. Kaposi's sarcoma. It's purplish, as you can see, and it goes along with human herpes virus 8, and it is epidemic in people with AIDS and is one of the indicators that a person may in fact have AIDS. Herpes virus has been found in the lesions and may play a part in the development of this. Surgery is indicated, chemotherapy, and radiation. Malignant melanoma is the most serious type of skin cancer, and it arises from the melanocytes of the epidermis. It is highly malignant. It does metastasize quickly, and it may develop from a mole. It is usually excised, and surrounding lymph nodes are often excised, and now they are doing what is called sentinel lymph node analysis, which means the lymph node closest to the lesion is excised first. If that does indicate malignancy, malignant cells in that lymph node, then the next one will be excised until they have found the extent of spread. Prognosis depends upon how far the disease has spread and how completely the tumor is excised. Here's what it might look like. Metabolic skin disorder like psoriasis is characterized by cracked red bleeding scales on the scalp, knees, elbows, and trunk, and it's characterized by an abnormal rate of epidermal cell production and turnover. Overactive T cells are the cause. The scales seen in psoriasis are not the cause, but are the effect. So that is the outcome of the disease, overactive T cells. And there are various treatments, including emollient cream, coal tar, ultraviolet light, and a cancer drug can be used as well. And organ transplant rejection drug, cyclosporine, is often effective. Here's what psoriasis might look like. Here it is enlarged via an electron micrograph, and here is what the scaly lesions look like. Pressure injury of the skin includes decubitus, ulcers, also known as bed sores, corns, and calluses. And these injuries to the skin occur when pressure decreases the blood flow to an area of the skin. Decreased blood flow, decreased oxygen and nutrients, the tissue necrotizes or necroses, it dies, in other words, and decubitus ulcer is one of those types of conditions. It can affect the bone areas of the body because that is where most pressure occurs. And if the ulcer becomes infected, a foul-smelling, purulent discharge is present. People who are confined to bed or wheelchairs, etc., who are immobile, develop this condition. Treatments include antiseptic irrigation, gelatin sponges, debriding agents, antibiotics, repositioning, and the repositioning will increase the blood flow to the irritated area because it will decrease the pressure. So if you are working with people who are confined to either a wheelchair, a bed, or otherwise immobile, make sure that you help them, or that whomever is caring for them moves them. This is what it looks like. Those lesions can go all the way through to the bone, extremely painful and unpleasant. Burns, obviously many causes of burns: fire, steam, hot water, sunlight, chemicals, electricity, and they are classified according to the depth of skin that is involved, anywhere from first degree, which are superficial, second degree, which are called partial thickness, or third degree, which are full thickness. The danger in full thickness is that the broken skin exposes the underlying fat tissue. The person may suffer from shock because they are losing fluid and they have lost that protection that the dermis and epidermis allow, and so they are susceptible to infection as well. Grafting is often necessary. Here is a first degree or superficial burn. Here's a second degree or partial thickness burn, and here are third degree or full thickness burns. Note the charring. In this picture you don't really see the exposed muscle, although in this foot you can see how it has penetrated all the way through the muscle, to the muscle, and even beyond. Here's a chart for determining the extent of a burn, and this, I'm not going to belabor this, but there are ways to determine the extent of the burn and therefore the danger. Age-related diseases of the skin: the structure and function changes, touch sensation decreases, making burns and frostbite more likely because you cannot tell. Xerosis or dry skin is a major problem. The epidermis becomes thinner and retains less water. The sebaceous glands do not function as well, the oil-secreting glands, and this adds to the problem of xerosis or dryness. Elastic fiber is replaced by collagen fiber. Nails become thicker and difficult to trim. Hair becomes more brittle, sometimes thinner, and it may lose its pigment, or the hair may be lost itself. Seborrheic keratosis is a benign overgrowth of the epithelial cells, and this is common as well. The cause is unknown, but usually the lesions do not become malignant, and they can be removed by curettage. Here's what a seborrheic keratosis might look like. Notice it does resemble, in some ways, some of the skin cancers. So if you have any kind of a lesion, do not assume that it is benign. Here's actinic keratosis, another type of keratosis. All right, I'm finished with this section, and there are on your Moodle page films on the following topics: skin cancer, decubitus ulcers, and osteoporosis. So please go there, take a look at those films, study, contact me with any questions you might have, and be sure that you remember, and I know I'm nagging you a bit about this, but be sure you remember that the non-narrated versions of all of the YouTubes I have made are available to you, so you can take your time and study and read as much as you like. All right, that's it for now. Happy studying.